We'd be remiss if we didn't acknowledge a major change surrounding something that has affected all of our lives. The national emergencies brought on by the pandemic are now officially over. We've reached a medical milestone, 3 years in the making. Thursday, the White House officially closed the book on a declared public health emergency, about a week after the World Health Organization did the same. Biden administration officials say there's a plan in place now to push our country forward.
We want to make sure that no one suffers as a result of things getting better as a result of COVID. And so that's why we've been working closely for months, close to a year now, with governors to try to make sure the transition from the public health emergency goes smoothly.
So now what? Well, doctors point out the official changes don't mean the virus is gone. More than 8,700 people are still in U.S. hospitals fighting COVID. And the latest numbers show it's still killing more than 300 people a week in the U.S. More than 1.1 million people have died from COVID-19 in our country over the course of the pandemic. But it's less of a threat because of vaccines and science and immunity. So what does the end of this emergency mean for you? Well, first off, get ready to pay for tests. Though health insurance companies will continue to cover tests ordered by a medical provider, you'll likely face deductibles and copays as part of that coverage. Vaccines will still be free as long as federal supplies last. The FDA will still have the power to authorize certain COVID treatments on an emergency basis. Reporting will also be different. The CDC will no longer report new daily infections as we've seen these past few years, in part because states are no longer required to report new case totals and at-home testing has become the norm. Health experts will keep an eye on hospitalizations, though.
The bottom line is that the CDC will still be able to tell that it's snowing, even though we won't be counting every single snowflake.
National health officials say even with this drop in reporting, our understanding of COVID will actually be better than it is with other respiratory viruses like the flu and RSV. Let's face it, when it comes to these changes, the writing's been on the wall for a while now as we've gotten back to a version of what we remember before the pandemic. It's almost surreal to reflect on what life was like when the emergency started.
This isn't a maybe. It is coming.
Dr. Steve Stites and Dana Hawkinson began briefings from the University of Kansas Health System in March of 2020, right after we hit the pandemic, hovering around a phone in a studio, taking reporter questions as the hospital triaged testing in an ambulance bay. A lot has happened between now and then. And today in 2023, when it comes to what this latest news means for patients, there's a lot worthy of your attention. So please welcome back Drs. Hawkinson and Stites with the University of Kansas Health System in that very same studio. Thanks for coming back on, gentlemen. First, I have to ask you what this means to you personally to be on the other side of this health emergency, knowing what you know now. Dr. Hawkinson, let's start with you.
Yeah, I think it really centers on individual and population immunity. When the pandemic was first announced and the virus was circulating, we knew that really so many different populations and demographics were affected by this. As we have now moved through this pandemic and we've had great funding and resources for vaccination and for therapeutics with antivirals, we've also had people who have been infected and reinfected. And through vaccination and infection, as an individual and as a population, we have gained some of that immunity to impact and decrease the overall chance that you are going to go to the hospital, go to the ICU, and die. This disease has really become more of a disease of those most at risk, those with higher age, those with immune compromising conditions. And so by doing those other things, such as being up to date with your vaccines, getting tested early and getting treated with antivirals, we can now impact and decrease your chance of coming to the hospital, having severe disease, and dying. And so I think that matters the most because now we are not filling all of those beds with COVID patients. We can now see and treat those people that need to be treated for other common conditions that were around even before the pandemic.
Cody, what I'd like to say is that we're on the other side of the pandemic. What I'd say is we're in a different spot in this pandemic. And the truth is, as we went through this pandemic, we talked a lot about the intersection of faith, hope, and science. Faith that we were going to get through this, hope that we would help support each other in science. A lot was made about the divisiveness about it. But the truth is, there are a lot of people who work together to help us get through this. And I think the science has been remarkable. We have never seen anything come to fruition so fast as vaccination and antiviral therapy to combat what was a modern human plague. And at the end of the day, we now, as Hawkeye has mentioned, we are in a much better place than we were. If we were to just stop and press pause for a moment, we have to express admiration for all the people who work so hard to help keep people healthy throughout this time period. We lost 1.2 million Americans. We have at one point 250 patients hospitalized with COVID, and I think right now we have 28. we are in a much better position. We're still vulnerable, but thank goodness for that intersection of faith, hope, and science.
What does the end of this emergency mean for the people in your care? Because I know Medicaid patients have to pay very close attention now.
Yeah, I think one of our challenges, Cody, is going to be that people who were on Medicaid didn't have to show on a yearly basis that they still qualified. So there's a little expansion of it, and there were people on it who, once they started working, didn't come off of it. Well, now you have to prove that you still qualify for Medicaid. It's estimated that between 10 and 20% or more of the people on Medicaid currently will have to come off of it. That means they will have to find other ways to access health insurance, whether it's through their job or through, through Obamacare, the Affordable Care Act. But that comes with a cost. So I'm sure, unfortunately, there are going to be some people who will lose access to health care.
Now, I know, Dr. Hawkinson, we found new ways, as you know, to work in the last 3 years, and I know that's an understatement, but especially with the internet, Zoom calls and telehealth have become very popular. Does that continue now?
You know, it will continue. I know it is evolving. We have a great group of people working here at the health system led by Dr. Keith Sale on the telehealth. It has been such a boon for treating patients who maybe can't get out as easily, or even patients in other parts of our state as well. So we know that will continue. It continues to evolve, but I think it's evolving in the right direction in a positive way to continue to bring health care and access to maybe people who normally couldn't get it as readily as they can at this point in time.
Dr. Stites, we'll end with you. What's your advice to the public as we begin this new chapter, turn this page?
Well, yeah, I bet you could know what I'm going to say, Cody. The rules of infection prevention control travel with you and help keep you safe no matter where you go. And whether it's COVID or influenza or RSV, etc., just be aware. And the way to be aware is you can follow our program, or you can follow your program, or you can read. But at the end of the day, what you really want to do is make sure you know how to stay safe, wear a mask, keep your distance, all the things we always say. If you're sick or you're in a position where getting sick could mean some really bad things for your health. I think that those rules help keep us safe. They will continue to keep us safe. And as we follow along different infectious diseases and different seasons in this country, we just have to make sure that we know what the rules are. We know that they can continue to keep us safe.
All right, Dr. Steve Stites and Dana Hawkinson, thanks for everything you and your staff have done and continue to do. We appreciate it. Count on KMBC 9 News. We'll be watching for any new changes to the state of the pandemic and what they mean for you on air and online at KMBC.com.